You step off a curb, miss the bottom stair, or plant your foot on uneven ground, and in a split second your ankle rolls inward. There's a sharp twinge on the outside, maybe a pop, and within minutes it's swelling and tender to stand on. If that sounds familiar, you've likely had an ankle sprain, one of the most common injuries I see in the clinic. The good news is that most ankle sprains heal well with the right care, and you can often help that healing along yourself. In this video, I'll walk you through what actually tears inside the ankle, how to tell how serious it is, what to do in those first crucial days, and how to rebuild so it doesn't keep happening. To understand why a sprain hurts where it does, picture the outer side of your ankle. Running between the lower end of your fibula and your foot bones are several tough bands called the lateral ligaments. The most important one for sprains is the anterior talofibular ligament, or ATFL, a small strap at the front of the outer ankle. When your foot rolls inward, that ligament is usually the first thing to take the strain, and it's the one most often injured. Ligaments are like strong ropes that hold bones together and keep the joint stable. When they are stretched beyond their limit, the fibers can partially or fully tear, which triggers bleeding, swelling, and that bruised, throbbing feeling. That's also why the outer ankle often turns black and blue a day or two later. Doctors often describe ankle sprains in 3 grades. A grade 1 is a mild overstretch with minor swelling and you can usually still walk. A grade 2 is a partial tear with more swelling, bruising, and a wobbly, tender feeling. A grade 3 is a complete tear, often with marked swelling and difficulty putting weight on it. Now, a common worry is whether a bone is broken, and here's a helpful concept clinicians use. There's a simple set of guidelines, sometimes called the Ottawa ankle rules, that helps decide who actually needs an X-ray. In plain terms, an X-ray is more likely warranted if you can't take a few steps on it, or if there's tenderness right on the bony knobs of the ankle. Most sprains in the first few days, the goal is to protect the ankle and let the swelling settle. You may have heard of RICE, which stands for rest, ice, compression, and elevation, and the newer guidance called peace and love that adds gentle, gradual movement once things calm down. In plain language, here's the idea: avoid aggravating activities early on, but you don't need to keep it completely still for long, because gentle motion actually helps healing. Elevating the ankle above heart level and using a snug compression wrap can help control swelling. A short period with an ankle brace or support often makes walking more comfortable and protects those healing ligaments. Many people use ice and over-the-counter pain relief for the first days, but check with a pharmacist or doctor about what's appropriate for you. Once the worst swelling settles, rebuilding the ankle is what protects you from the most common problem after a sprain, which is spraining it again. The first thing to recover is gentle range of motion, like slowly tracing the alphabet with your toes to get the joint moving. Next comes strength, often using a resistance band to push the foot in each direction. But the part people skip and shouldn't is balance training. A sprain dulls the ankle's sense of position, so practicing standing on the injured leg, eventually with your eyes closed or on a cushion, retrains that built-in stability. Return to running, sport, or hiking should be gradual, guided by comfort and confidence rather than a fixed calendar. For people who sprain easily, a brace or taping during sport and ongoing. So when should you stop self-managing and get it checked? See a clinician promptly if you can't bear weight or take a few steps. If the ankle is severely swollen or badly deformed. If there's numbness, persistent tingling, or the foot looks pale or cold. Or if you have tenderness directly on the bony knobs, which can signal a fracture. Also seek care if the ankle feels unstable and keeps giving way. If pain wakes you at night, or if it simply isn't improving after a couple of weeks of sensible self-care. To recap, Most ankle sprains are ligament injuries on the outer ankle. The ATFL takes the brunt, and the great majority heal well with early protection, gentle movement, and a real rehab plan that includes balance work. Be patient. Rebuild